Hi, welcome to Making It on Monday. This week is all about 2023 checklist. If you're trying to conceive or you want 2023 to be the year where you start a family and have a baby, then this checklist is for you. We're going to go through today just the top 5 tips we recommend for things that you can do now that are going to start improving your fertility and your chances of conceiving in 2023. So it's super exciting. Happy New Year, everyone. And welcome to Making It on Monday. So Making It on Monday is a weekly workshop we do for mums and dads in the making. And it's all about empowering you with resources and information and education about how to improve your fertility. So Make It on Monday is brought to you by the Acupuncture Pregnancy Clinic. The Acupuncture Pregnancy Clinic, which is an integrative traditional Chinese medicine clinic that is dedicated to fertility support, IVF support, and pregnancy care. And so today I am your host. My name's Amy Forth. I am the director of the Acupuncture Pregnancy Clinic group, and I'm really happy to be here today and share with you my top 5 tips for increasing your chances to conceive in 2023. So we're going to start with trying to conceive, just 101. We need a really healthy egg and a really healthy sperm, and we need them to fertilize. So today we're going to talk about the egg and the sperm and what are those kind of key components that are going to make a really big impact. So whether you're trying to conceive, you're in a same-sex couple, or you're trying to conceive naturally in a heterosexual couple or through IVF, all of this is really relevant because we're looking at the sperm and the egg and how we can impact it. And so to start off with, I want to start off with the time frame in terms of the sperm and the egg. So from when it starts off as like a little immature cell, and then it grows and grows and it gets more and more mature into a point where it's either ovulated or ejaculated, and then that is then going to go on and fertilize and create an embryo and potentially like a really healthy baby. So what we're looking at is everything that's going to impact that sperm and that egg through that whole 3-month period. So if you're trying to conceive in 2023, or you're trying to conceive now, or you're thinking about trying to conceive, it's really important that you keep this kind of 3-month window as a preconception phase, because it can make a massive impact in terms of not only your fertility in terms of how quickly you conceive, but also having a healthy pregnancy, reducing your rate of miscarriage, and also having a really healthy baby. So some of the tips I'm going to go through today not only improve your fertility, but they also help with creating healthy cells and the healthy replication of DNA, and really help you improve your chances of not only conceiving, but having a really healthy baby, which I think we can hands down probably all agree is what you're after. Okay, so tip number 1. Now, this is not going to kind of really surprise you, but it's all about nutrition and diet and your environment. So having a really clean and healthy diet. So for fertility, a Mediterranean diet is advised as like the best option. So this is healthy fats with amino acids, and you want lean, healthy protein, as well as a lot of fresh fruit and vegetables, and limited carbohydrates, reduced carbohydrates, only complex carbohydrates, and limited processed and sugars, foods and sugars. Yeah, so that makes sense. Nice, healthy, which is great if you're in summer right now, as we are in Australia, then, you know, it's a great time to have a Mediterranean diet. So number 1, a Mediterranean diet. And also we want to try and keep our body as low toxic as we can. And so this is partly in terms of like the food that we're eating. So we're trying to reduce any kind of toxic load. And we also want to reduce things like caffeine, coffee, and alcohol. So coffee and alcohol can both have a bit of toxicity on the system, and they're not that great. They're not that helpful in terms of fertility. So if you're a coffee drinker, really trying to reduce that to absolute bare minimum of having maybe 1 or 2 a week. And the same with alcohol, really bare minimum, maybe 1 or 2. But really, if you can avoid it completely, it's going to do wonders for your health and fertility. Reducing both coffee and alcohol for the male and the female, it not only helps you conceive more quickly, but it also it reduces your miscarriage rate. So it's a really great one to do if you can incorporate it. And now we've gone past the silly season, it might be easier to kind of, you know, take a bit of a break, especially when it comes to alcohol. And now that other thing I really want to talk about is the environmental toxic load in your household. So things like your cleaning products, or things like your hair and shampoo, things like nail polish and hair dye, also just your general things that you're using in your home, and also either on your body or hair. You really need to look at them and make sure that they don't have too many chemicals, because these are really absorbed into our system. And again, any kind of chemicals or toxic load is really going to not be helpful for that developing sperm and egg. So that's for that full 3 months, minimum full 3 months prior to you conceiving. So things like your SLES or SLS, or your parabens, they're all the things that you want to check for on the label. Also going BPA free, making sure you're not getting drinking out of plastic water bottles. These are all really important tips. So that's just tip number 1. So it's really kind of about getting clean, having clean, healthy diet, and also having like a really low tox environment. Tip number 2 is all about checking out what is going on. So you want to book in with your GP or your fertility specialist if you're seeing one, but it's really important to do a prenatal check and make sure that you have hormonally and nutritionally, there's no kind of barriers for you being like optimally fertile. And some of the key things that we really want to look for here is things like your vitamin D status, which is so important in terms of you having your fertility, or if you're doing IVF, having a good cycle. It's really having a sufficient vitamin D status directly can kind of impact your IVF outcomes, and also for your fertility outcomes for both the male and the female. So that's something you want to check out straight off the bat, and we want them around about 100 as a result. Around 70 is fine, but we really want them up for 100 for fertility. Also checking out, if you're a male in particular, zinc status, and then your B12 and iron. It can be really kind of some of the key tests that you want to check out. As well as the other one we always check in the clinic is making sure that the thyroid is functioning really well. So talk to your GP or integrative doctor or fertility specialist about doing a comprehensive panel if you haven't had one done in the last 6 to 12 months, or you haven't had one before, as this is really these are kind of key components in terms of you having a really great fertility, and making sure that your nutritional and also your hormonal status is fantastic. So that's tip number 3. And then that's tip number 2. Tip number 3, we are moving on to supplements. And because nutrition is so important in terms, and a lot of nutrition is like the basic building blocks, it's just so important in terms of you creating like a healthy embryo, creating healthy sperm, and also creating the healthy egg. So one thing that we often recommend is that people take fish oils, because they're the amino acids, which are the essential building blocks for all cells. So these are really great for improving kind of gene expression, as they're the building blocks for really good DNA. So amino acids, obviously, they can come in fish oils, or you might not know that, but they come in fish oils, things like flaxseed oil as well. But these are really essential, and most people are deficient. And deficiency can reduce your fertility, but also it can lead to like a low birth weight in babies, and also reduction in their brain development. So get onto amino acids in your diet. If you're taking some supplements, ask your practitioner for a really good type of supplement. Because all fish oils aren't made the same, and all supplements aren't made the same. And you want to make sure that you're taking an appropriate dose, and you also want to be taking a really good product, which often the better products are the practitioner only range. So ask your practitioner about what's a good one. Coenzyme Q10, you've probably heard of ubiquinol, and this is really key for mitochondria function. And so as we age, this mitochondria function can be reduced, and so this is again really essential for like having really healthy cells, which are basically what egg and sperm are. Really healthy. We want them to be really healthy cells. So it's a key role in kind of protecting DNA at a cellular level, and helps also guard against oxidative stress. So coenzyme Q10, again, they can be such a range in quality, so ask your practitioner about which one. Magnesium is something we also often prescribe at the clinic because it's great. It's a muscle relaxant. It really helps with sleep and also energy production. And it also can help with the hypothalamic pituitary axis, which is all about menstrual regularity, hormonal regularity. So that's another one we often will prescribe at the clinic. And then vitamin D is also another key nutrient that we'd often prescribe, and again because it's just so important for fertility. So people who have sufficient vitamin D are more likely to have better outcomes when they're undergoing IVF. So that is tip number 3. Let me just turn around my notes. And then tip number 4, we're going to be talking all about Chinese medicine herbs, because I love Chinese medicine herbs. And recently I did a talk all about Chinese medicine herbs for an hour, and I learned a lot about the most recent research, and some of it is pretty impressive. So one of the key formulas which we use at the clinic are called one of the prep to conceive formulas, is based on a formula called Lu Wei Di Huang Wan. And this formula has had a randomized control trial conducted where women would take it for 3 cycles before they underwent IVF. And they just take it in the follicular phase, so from when they had their period to when they ovulated. And these women, then when they underwent IVF, their egg quality and the amount of eggs that they got through IVF, also the embryo quality was improved in comparison to the women who didn't take it. It also showed a really vast improvement in terms of clinical pregnancy rate, where it's up to kind of 63% in this study, which was conducted by Fang in 2014. And there was another meta-analysis which came out, which looked at a lot of the research around herbal medicine, Chinese herbal medicine for fertility in 2020. And this basically concluded that when taking Chinese herbal medicine, it really significantly seemed to improve not only live birth rate, but also the clinical pregnancy rate. So taking Chinese herbal medicine for 3 months prior, before you start an IVF cycle or start trying to conceive naturally, is really important, and it can be really beneficial for both men and women. And then the last thing I want to talk about, tip number 5, is acupuncture, because we are the Acupuncture Pregnancy Clinic. That's what we're really passionate about. But acupuncture has also has a lot to help in terms of fertility. It improves blood flow to the ovaries and also to the uterus. It also helps increase ovulation and menstrual regularity, improve overall fertility, and also has a great added bonus where it helps boost up your endogenous opioid production, so it helps mitigate stress and helps you really relax. So having acupuncture is really worthwhile. The 2015 study by Hollander, she looked over 1,000 patients, and she found that the women who did about 12 sessions of acupuncture, so this was either weekly for about 3 months, or they would do twice weekly for 6 weeks. She found that they had a much improved clinical pregnancy rate and live birth rate. So the live birth rate was actually around sort of 61% in those who did what they call whole systems Chinese medicine. So they had acupuncture, and alongside the acupuncture they also had the herbal medicine if it was appropriate, and also supplements. And that's definitely how we like to work at the clinic. So the checklist for 2023, if you're starting to think about trying to conceive or doing an IVF cycle, wherever you're at, it's really good if you can have a 3-month window where you're really concentrating on these kind of preconception practices. And so number 1, eat clean, have a low tox environment. Number 2, go to your GP, have a comprehensive prenatal screen. Make sure your vitamin D, your zinc, your B12, your iron, and your thyroid is all performing very well. Number 3, make sure you get some really good supplements. And of course, I didn't even mention folate in this one, but of course you need folate, a really good prenatal supplement. We've got another video also all about how to spot a really good prenatal supplement. So check that out if you want more information about finding a good prenatal supplement. Also, ask your practitioner, ask your Chinese medicine practitioner or your naturopath. They're going to really help guide you in terms of what is a really good prenatal supplement, as well as in terms of like the doses and also the brands or the good quality products in terms of supplements, because there's some not so good stuff out there, but there's some really high quality and well-researched products as well. Number 4, herbal medicine. If you haven't considered it before, it can be really helpful in terms of fertility. I just mentioned one of the meta-analysis, which suggested that live birth rates can really significantly improve when people take herbal medicine before an IVF cycle. And then number 5, of course, is acupuncture. We love acupuncture, and acupuncture can be wonderful in terms of improving blood flow to the uterus, to the ovaries, and also just helping overall hormonal regulation and optimizing hormone function. So if you have any more questions, please get in touch. You can leave them in the comments box. And we've got some other videos that relate that we'll leave the links in the show notes. But today, thanks for joining me for Making on Monday, and happy 2023, everyone. And I hope these 5 top tips have really helped you. Thanks. Bye.